Hi, beautiful people. Welcome to our channel. If you are new here, don't forget to smash that subscribe button and ring the bell to stay updated on all our latest health tips and tricks. Before we start, if you find this video helpful, please give it a big thumbs up. It really helps us reach more people with this crucial information. Hypertension, or high blood pressure, HTN, is a multifactorial condition influenced by lifestyle, diet, and genetics. Among the nutrients playing a pivotal role in maintaining healthy blood pressure, Vitamin D, magnesium, and potassium stand out as key players. Their combined effect on cardiovascular health, blood vessel function, and overall fluid balance can significantly reduce the risk of hypertension. Let's delve into the relationship between these essential nutrients and how they work together to prevent high blood pressure. Vitamin D and hypertension prevention. Vitamin D is best known for its role in calcium metabolism and bone health, but research shows it also plays a significant role in cardiovascular health and blood pressure regulation. Regulation of the renin-angiotensin system. Vitamin D helps regulate the renin-angiotensin system, RAS, a hormone system that controls blood pressure by regulating blood vessel constriction and fluid balance. Low levels of vitamin D lead to an overactive RAS, causing blood vessels to constrict and increase blood pressure. Reducing inflammation. Chronic inflammation is linked to the development of hypertension. Vitamin D helps reduce inflammation in blood vessels, improving their flexibility and reducing the risk of stiffening, a condition often associated with high blood pressure. Supporting calcium balance, vitamin D aids in calcium absorption, which is important for blood vessel function. When vitamin D levels are low, calcium metabolism is affected, which may increase blood vessel stiffness and pressure. The vitamin D deficiency and hypertension link. Individuals with low vitamin D levels are more likely to experience elevated blood pressure. Vitamin D supplementation has been shown to reduce blood pressure, particularly in people with deficiencies. Magnesium's role in blood pressure regulation. Magnesium is an essential mineral that plays a crucial role in muscle function, including the muscles of the heart and blood vessels. It works in tandem with both vitamin D and potassium to maintain healthy blood pressure. Vasodilation. Magnesium helps relax and widen blood vessels, a process known as vasodilation. This reduction in blood vessel tension allows blood to flow more easily, lowering blood pressure. Modulating the renin-angiotensin system. Similar to vitamin D, magnesium also influences the renin-angiotensin system, ensuring that blood vessels do not constrict excessively. Adequate magnesium levels help balance this system, reducing the risk of hypertension. Supporting electrolyte balance. Magnesium works closely with potassium to maintain proper fluid and electrolyte balance in the body, which is critical for controlling blood pressure. Without enough magnesium, potassium cannot be retained efficiently, which can negatively impact blood pressure control. Magnesium deficiency and hypertension. Studies show that magnesium deficiency is associated with higher blood pressure and a greater risk of cardiovascular disease. Supplementing with magnesium or increasing intake through dietary sources, such as nuts, seeds, leafy greens, and whole grains, has been shown to reduce systolic and diastolic blood pressure, particularly in people with hypertension. Potassium's vital role in preventing hypertension. Potassium is another crucial mineral that plays a direct role in lowering blood pressure by balancing the effects of sodium and promoting proper fluid regulation in the body. Balancing sodium levels. Potassium helps the body excrete excess sodium through urine. Sodium retention is one of the primary drivers of high blood pressure, as too much sodium in the blood increases fluid retention, leading to higher blood volume and pressure. By ensuring that sodium is flushed out effectively, potassium helps lower blood pressure, relaxing blood vessels. Similar to magnesium, potassium helps relax the walls of blood vessels, allowing for smoother blood flow and reducing the strain on the cardiovascular system. Improving heart function. Potassium is essential for proper heart muscle function, maintaining a healthy rhythm, and preventing issues like arrhythmias, which can exacerbate cardiovascular problems associated with high blood pressure. Potassium deficiency and high blood pressure. People with low potassium intake are at higher risk for developing hypertension. This is especially true when their diets are high in sodium. Increasing potassium intake through fruits, bananas, oranges, avocados, vegetables, leafy greens, potatoes, and legumes can help significantly lower blood pressure, particularly in individuals with hypertension. How vitamin D, magnesium, and potassium work together. These three nutrients don't operate in isolation. They have a synergistic relationship that makes their combined presence critical for heart health and blood pressure regulation. Vitamin D enhances magnesium absorption. Vitamin D helps regulate calcium and phosphate levels in the body, and it also enhances the absorption of magnesium in the intestines. Without sufficient vitamin D, magnesium absorption is impaired, which can lead to magnesium deficiency and an increased risk of hypertension. Magnesium and potassium for electrolyte balance. Magnesium helps regulate potassium levels in the body. Magnesium deficiency can lead to potassium loss, which in turn can increase blood pressure. Together, they help maintain optimal electrolyte balance, ensuring that blood pressure remains stable. Synergistic blood vessel. Health, magnesium, and potassium both play essential roles in keeping blood vessels flexible and healthy. When combined with the anti-inflammatory effects of vitamin D, this nutrient trio helps prevent the stiffening of arteries that leads to hypertension. Practical tips for optimizing these nutrients to prevent hypertension. Get enough sunlight for vitamin D. Aim for 15-30 minutes of sun exposure daily, depending on your skin type and geographic location. If you're not getting enough sunlight, consider taking vitamin D supplements, especially during the winter months. Eat magnesium-rich foods. Incorporate foods such as almonds, spinach, pumpkin seeds, and whole grains into your diet. These are excellent sources of magnesium and will support healthy blood pressure regulation. Increase potassium intake. Focus on adding potassium-rich foods such as bananas, avocados, sweet potatoes, and leafy greens. Reducing processed foods that are high in sodium can also help balance the potassium-sodium ratio in your body, further reducing the risk of hypertension. Consider supplementation if needed. If you find it difficult to get enough vitamin D, magnesium, or potassium from food sources alone, talk to your doctor about appropriate supplementation. A healthcare provider can assess your nutrient levels and recommend the correct doses based on your individual needs. Conclusion. Vitamin D, magnesium, and potassium are essential nutrients that play interrelated roles in preventing and managing hypertension. Vitamin D supports both magnesium and potassium absorption and function, while magnesium and potassium work together to regulate blood vessel flexibility and sodium balance. By ensuring adequate intake of these nutrients, either through diet or supplementation, you can significantly reduce your risk of developing high blood pressure and protect your heart health. Thank you for watching. Don't forget to like, subscribe, and hit the bell icon for more health and wellness tips. Stay healthy and youthful.